When you and I first met, I was coming off of a journey of trying to find solutions for a lot of the work that you see on the screen. And there were two particular cases at that time that I was told I needed an implant. And so by a dentist locally, before I met you, and he didn't do the implants. And so I started looking around and I started thinking, wow, this isn't cheap. Maybe I can save a few pennies here and there. And so I thought, destination dentistry, let's go to Costa Rica. And I did save some money, but at the end of the day, they failed after 6 months or so. And so that's how I met you. I came into your office. And so, number one, I think people out there don't understand, like myself, that implants can fail. Can you explain that to me? Do implants ever fail?
Implant, of course, can fail. Fail for many reasons. I don't want to go first to the failure because of the dentist, but can be other kinds of failures. Failure because the patient medical condition or the bone is not good enough to tolerate that. You need to have a good ground, good bone, to place the implant inside.
How do you know that?
With this new technology, the CT scan, we can measure the density of the bone and we can have an idea before we start. Do we have really good bone to start with or no?
So can you show us? Give me an example. So, okay, now I'm
like
on the record saying I'm okay having my stuff being shown on the screen. So show me, what are you looking at when I first come in to see if an implant, the probability of success for an implant?
Well, for example, like when you came to me, you had a failed implant in this location. This is the one that we replaced, remember? Mm-hmm. Okay. So if we compared right to left side, okay, this is your right side, this is the left side, right? So the implant wasn't placed in enough bone. If you measure this area here, I can measure it like 3 millimeters, right? So whoever placed the dentist for you in the first time didn't build enough bone. He just like plugged in an implant and half of it was already hanging inside the sinus. So we can't do that. Without this kind of technology and to see exactly how much bone we have as far as like height, and also we can't also ignore the width. We can see the width from here. You have enough width to place implant, but you don't have enough height. Here is the sinus. So we basically need to build some bone here with a procedure, we call it sinus lift, in order to place the implant. So what we did in this side that we placed the implant for you, that we built bone here. We built all this bone up in order to place the implant inside bone, not hanging in the air like this.
Okay, so show me that one more time. Where did you build the bone up?
Okay, compare this area here.
Correct.
And it was the same like in this area.
Okay.
Right? But we built all this bone on top in order to place this implant inside.
So you had to lift up the sinus, that's why they call it a sinus lift. You had to basically pack bone in there.
Inside, exactly.
Inside to create enough foundation to let that implant have enough sturdiness to survive.
Have the right ground, height-wise, width-wise. All this need to be calculated and put in consideration.